During this morning's hearing on the youth mental health epidemic, we're going to have an opportunity to build on last week's superb discussion with the Surgeon General, Dr. Murthy. Last Tuesday, Dr. Murthy told us that mental health problems often show up first when we have people who are very young, but the average delay between the onset of mental health symptoms and the beginning of treatment is actually 11 years. Those are, in the Surgeon General's words, 11 long, confusing, isolating, and painful years. This obviously is a number worth 1,000 words. And more than anything, it says that America's approach to mental health care is way out of whack. And it starts failing America's young people early on. So several priorities for today. Let's focus on how mental health care for young people starts much earlier. Earlier screenings, earlier interventions, earlier discussions with primary care doctors. There's also a need to step up mental health efforts in schools and in our communities. Those are also places where trained professionals can get the symptoms right from the outset and refer young people to skilled practitioners when necessary. At present, we get told again and again that school counselors are overwhelmed, community-based programs are too few, and referrals are inconsistent. Mental health care simply doesn't start early enough, and it's not reaching young people where they are, especially kids in rural areas. Second, our country must have better crisis care. The 11-year treatment gap is a sign that young people are struggling, going without the treatment they need and heading on a path to crisis. In addition, America's mental health system too often fails the young when they're in crisis as well. The evidence shows that the pandemic has driven a shocking increase in self-harm among young people. Suicide attempts among young teen girls resulting in hospitalizations recently jumped more than 50%. Far too many of these young people in distress are spending days or even weeks boarded in emergency departments. For the bulk of the time, they're probably alone. Imagine colleagues feeling a sense of extreme isolation, clashing with chaos and commotion of the emergency department buzzing outside your door. Just yesterday, I spoke with a group of Oregon healthcare practitioners and physicians who told me they were concerned that in many of these crisis situations, young people who end up in the hospital emergency rooms aren't even seeing practitioners with those who have training in mental health. The emergency room is no place for a child in crisis to spend day after day, but it's all too common. Young people simply deserve better. Third and finally, solving these problems is going to require creativity from the public and the private sector. The Children's Health Insurance Program and Medicaid, which is the largest single payer of mental health care for young people, can play a key role in sparking new solutions. These efforts will be essential to make sure that mental health is treated with the same consistency and focus given to physical health. The bottom line is no more mental health business as usual, because business as usual is failing too many young people at every single point, from the first sign of symptoms to the most critical moments of crisis. That's a lot for the committee to discuss today on these key issues. We're going to have a great panel. that I'm going to introduce shortly. I want to thank Senators Carper and Cassidy for heading up our efforts on youth mental health care. And I also want to commend Senator Stabenow for her years and years of work on behavioral health issues that are so important and that we'll build on.